Welcome to this informative and vital video about how diet can directly impact your quality of life, especially if you or someone you know deals with arthritis and its painful joint implications. Today, we'll explore the inflammatory foods to avoid to reduce joint pain in arthritis. But before we dive into this crucial content, I sincerely ask you to subscribe to our channel and turn on notifications so you don't miss any details. Following this video to the end is essential, as the information we will share could make a substantial difference to the quality of your life or that of someone you know. After all, understanding how your diet affects arthritis is a powerful tool for effectively managing this condition and, as a result, living a healthier, less painful life. So let's explore these valuable insights together and learn how to make more informed eating decisions to improve overall well-being. What is arthritis and its inflammation? Arthritis, a condition that affects millions of people around the world, is closely linked to joint inflammation, an immune system response that causes pain and discomfort. Chronic joint inflammation is a hallmark of arthritis, making controlling this inflammation essential to relieving symptoms. Understanding how foods influence inflammation is crucial for anyone dealing with this condition. Foods rich in omega-6 fatty acids, such as refined vegetable oils, can worsen inflammation, while a balanced diet with anti-inflammatory foods, such as fatty fish, fruits and vegetables, can help reduce pain and improve quality of life. People with arthritis. Therefore, by making conscious food choices and avoiding inflammatory foods, you can make a significant contribution to managing and relieving arthritis symptoms. Now that you know more about arthritis, let's look at the 7 foods to avoid. 1. Evil omega-6 fatty acids. Foods rich in omega-6 fatty acids play a crucial role in modulating inflammation, and their unbalanced intake can negatively affect people suffering from arthritis. While omega-3s, found in fish, nuts and seeds, have anti-inflammatory properties, an excess of omega-6s from refined vegetable oils, such as corn, soybean and sunflower oil, can promote an exacerbated inflammatory response in the body. This can result in more serious arthritis symptoms, including joint pain and swelling. Therefore, it is advisable to balance the relationship between omega-3 and omega-6 in the diet, prioritizing healthy sources of fat and reducing the consumption of foods that contain refined vegetable oils, thus helping to control inflammation and minimize the impact of arthritis on the joints. 2. Processed foods. Processed foods, often high in trans fats, sodium and artificial additives, pose a danger to individuals suffering from arthritis, as these components can exacerbate inflammation and increase joint pain. Trans fats, found in products such as fast food, snacks and fried foods, are known to promote systemic inflammation, making them an additional risk factor for worsening arthritis symptoms. Additionally, the high sodium content in processed foods can cause fluid retention, worsening joint swelling. Therefore, to reduce joint pain and improve quality of life, it is advisable to avoid processed foods and opt for a diet rich in natural foods, such as fruits, vegetables and whole grains, which have anti-inflammatory properties and can contribute to control of arthritis. 3. Refined sugars. Refined sugars, present in foods such as soft drinks, sweets, cakes and baked goods, are notorious inflammatory agents that can significantly worsen arthritis symptoms. When consumed in excess, these sugars cause blood glucose spikes, triggering an inflammatory response in the body. Furthermore, high consumption of refined sugars is associated with weight gain, which can increase the load on already inflamed joints and intensify pain. Therefore, for individuals experiencing arthritis, reducing or eliminating the consumption of refined sugars from the diet can be an important step in controlling inflammation and minimizing joint pain, promoting a better quality of life and well-being. Opting for healthier alternatives, such as natural sweeteners, when necessary, can be a useful strategy for those who want to alleviate the symptoms of arthritis. 4. Gluten and arthritis. The relationship between gluten and arthritis is complex and can affect people with non-celiac gluten sensitivity. Although gluten is primarily associated with celiac disease, some evidence suggests that individuals with rheumatoid arthritis, in particular, may experience improvements in symptoms when reducing their gluten intake. This is because gluten can trigger an immune response in the body, leading to systemic inflammation, which in turn can worsen joint inflammation. However, it is essential to highlight that the relationship between gluten and arthritis can vary from person to person, and not all arthritis patients will benefit from excluding gluten from the diet. Consulting a healthcare professional and performing appropriate gluten sensitivity testing is essential to determine whether this change in diet is relevant to relieving arthritis symptoms. 5. Dairy and inflammation. Some dairy products, such as milk and cheese, have been linked to increased inflammation in people with arthritis, mainly due to the presence of inflammatory proteins and possible lactose intolerance. In cases of undiagnosed lactose intolerance, dairy consumption can trigger gastrointestinal symptoms, which in turn can worsen joint inflammation. Furthermore, milk proteins, such as casein, can be perceived by the immune system as foreign agents, leading to the activation of the inflammatory system. However, it is worth noting that the relationship between dairy products and arthritis can vary from person to person, and not all individuals with arthritis need to avoid these products. It is critical to consult a healthcare professional or nutritionist to assess personal dairy tolerance and determine the best dietary strategy for controlling inflammation and relieving arthritis symptoms. 6. Processed and red meats. Processed meats and red meats, such as sausages, bacon and beef, are often associated with an increased risk of joint inflammation, which can be especially problematic for people who suffer from arthritis. These types of meat contain inflammatory compounds, such as heterocyclic amines and AGEs, advanced glycation end products, which can trigger and worsen inflammatory processes in the body. Additionally, the high saturated fat content in red meat may contribute to increased LDL cholesterol and the development of cardiovascular disease, which may be an additional concern for people with arthritis, as many of them are at increased cardiovascular risk. Replacing these meats with leaner options, such as omega-3 rich fish, skinless poultry, or plant-based proteins, may be a beneficial strategy for reducing inflammation and improving overall joint health in individuals with arthritis. 7. Foods rich in purines. Foods high in purines, such as seafood, organ meats, processed meats and alcoholic beverages, can pose a challenge for people suffering from arthritis, especially those prone to gout attacks. This is because purines are broken down in the body into uric acid, and high levels of uric acid can trigger the formation of crystals in the joints, causing acute inflammation and severe pain. Therefore, it is advisable to limit consumption of these foods and drinks, monitor blood uric acid levels and, if necessary, follow a low purine diet rich in foods such as fruits, vegetables, whole grains and low purine dairy products. Fat, to reduce the risk of gout attacks and minimize joint inflammation associated with arthritis. It is important to consult a healthcare professional to develop a personalized dietary plan tailored to individual needs. Alternative anti-inflammatory foods. Including anti-inflammatory foods in the diet is a key strategy for reducing joint pain and improving the quality of life for people facing arthritis. Fish rich in omega-3 fatty acids, such as salmon and sardines, have well-documented anti-inflammatory properties that help reduce joint inflammation. Additionally, colorful fruits and vegetables are sources of antioxidants and phytochemicals that fight inflammation, while nuts and seeds provide healthy fatty acids and plant-based proteins. Incorporating these foods into a balanced diet not only reduces inflammation but also promotes overall health by strengthening the immune system and protecting the body against arthritis-related illnesses. Therefore, by focusing on food options rich in anti-inflammatory properties, people with arthritis can experience significant symptom relief and improved joint function, contributing to a more active and comfortable life. It is important, however, to adapt the diet to individual needs and seek guidance from a healthcare professional or nutritionist for a personalized eating plan. In summary, understanding inflammatory foods to avoid in arthritis is essential for those seeking relief from joint pain and control of inflammation. Choosing a conscious diet, focused on anti-inflammatory foods and eliminating or reducing foods that can aggravate the arthritic condition, can have a significant impact on quality of life. However, it is essential to emphasize that each individual is unique, and what works for one may not work for another. Therefore, the CO consultation with a doctor or nutritionist is crucial to assess your needs, specific dietary guidelines and develop a personalized eating plan. Applying the principles discussed in this video, along with appropriate medical guidance, can help minimize joint inflammation and pain, allowing people with arthritis to live more comfortable and active lives. Therefore, seeking professional advice is the first important step towards effective arthritis management and a better quality of life. Thank you very much for watching this video and for investing in your health and well-being. Sharing this content with friends and family can be an incredible action, as arthritis affects many people and sharing valuable information can make a difference in their lives. So, if you found this video informative and helpful, please share it with anyone who might benefit. And don't forget to stay tuned for the next video that appears on your screen, where we continue to explore ways to live a healthier, happier life. To the next.